Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding, and it is the anatomical terms of direction types. So in this session, we are going to talk about what are the types that are available for anatomical terms of direction. We will talk why it is so important in respect to medical coding, and also we will see some of the other theoretical concepts related to that. But before we proceed further with it, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because those who have watched the previous session, they already know that what are anatomical terms of direction, right? Because that thing we have already covered. And in this session, we are mainly focusing on its type, right? So this is how you will be, it would be very easy for you if you following it sequentially. And for that, you can also refer the Texture Myth digital course book, which is freely available in the description box for all of you. And there you will find more than thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. And in case if you have any question over there, you can simply reach out to me. So in that book, like, there is a separate tab for medical coding where you will find all the sessions for medical coding. Okay. Alright. So now we will start the session. We will proceed one by one. Like, firstly, I'll show you all the types. Individually, we will discuss in upcoming session. But for now, we will just discuss what all types are there. Then we'll see some of the theoretical concepts to that. And at the end of the session, I'll provide you one very important question for interview that will help you to recall your concepts as well. Okay. All right. So let's see what all types are available for anatomical terms of direction. So mainly these are the 14 terms that we use or that are frequently used to explain or to show the anatomical terms of direction. Now what all terms are there? Let's see one by one. The first one is anterior, which is often called as ventral. Okay. So anterior, ventral. The second term is posterior, that means dorsal. Okay. So whatever terms is written in bracket are just alternative way to say it. So anterior ventral, posterior dorsal. Third is superior, which is for cranial. Superior cranial. Fourth is inferior, which is for caudal. Fourth is inferior caudal. Then we have medial, lateral, proximal, distal, superficial, that is external, deep, that is internal, ipsilateral, contralateral, bilateral, and unilateral. So these are the all anatomical terms that are being used to explain the directions of anatomical structure. Now remember, these are very important and individually, like, they are a topic. So what we will be do, like in upcoming session, we will discuss these topics individually in detail. But prior to that, we should know like why it is so important for us to learn, and also who are the professionals that why they are using it. Okay. So let's see that. So firstly, we will see who use these terms. Okay. So these terms are mainly used by doctors and surgeons, nurses, radiologists, medical coder, physiotherapists, anatomists, and pharmacists. Okay. So they all use the terms. But how? So let's see one by one. The first is doctors and surgeons to describe the location of a disease, injury, or a surgery site. Okay. So doctors and surgeons mostly use this term to identify or locate the disease, injury, and surgery site. Similarly, when nurses are going to prepare the document for it, so to document the patient condition accurately, they will be using these terminology, these directional terms. On the other hand, if we talk about radiologists, so they are using these terms to describe the findings on X-rays, MRIs, and CT scans. Okay. So to locate something in the body, to find something, to describe the findings, they usually use these terms. Next one is medical coders to assign the correct diagnosis and procedure code. They often use these terms because through these terms, like, they understand like where the issue is and what code is supposed to assign there. Okay. So it is useful for medical coders. Next is physiotherapist. Yes, so sometime like not sometime, like most oftenly when physiotherapist is going to tell or describe something about the muscle or joint location in a body, so for to denote a particular muscle or joint location, they often use this term, which will be helpful for them to explain the exact position in a human body in terms of muscles and joint location. Next is anatomist. So yes, to study and teach the body structure, they should know about all these terms because they are doing the research work, so accordingly they will find out the things. And the next one is pharmacist. Yes, so to understand the drug administration sites, they should know about these terms so that they can easily understand the drug administration sites. Okay, so these are the you can say professional who are utilizing and who needs these kind of terminology to understand the things properly. Next is the importance in medical coding. Okay, so now if specifically we want to know like how these terminology are utilized in medical coding, because this entire series is for medical coding, right? So how it is utilized. So here you can see diagnosis, like I clearly mentioned that in medical coding, ICD-10 CM and CPT coding, anatomical directional terms are used in diagnosis codes. Okay, so for example, if someone mention anterior wall myocardial infarction, it has completely different code than a posterior wall myocardial infarction. So now you can see there two terms are used, anterior and posterior, but these two terms change the entire thing, right? And accordingly, like they have to assign the code. So if they don't know the meaning of anterior and posterior, how they can assign the code? So for diagnosis code, they should know about these kind of directional term. Similarly, for procedure code, like you can see the example, anterior approach surgery versus posterior approach surgery. So they both are coded differently, right, according to their directional terms. If it is anterior, they will use some different code. If it is related to posterior, they will use some different code. Okay, so that is why it is so important to understand the procedure codes, to understand the directional term, to assign the procedure codes. Clear? Now the next thing is related to reports. So yes, for operative report, radiology report, pathology report, these terms should be known, right? So let's see. So in case of operative reports, surgeons use these terms to describe exactly where they are operated. Okay, so to just tell them like where they are operated, surgeons often use this operative reports with those terminologies. Similarly, for radiology reports, it is used to describe where lesion, fracture or tumor is located. So they should know about this thing. Okay, then pathology reports. So in order to describe which side or surface of our organ is affected, pathologists also use or refer these terms to identify or to describe the exact location of the organ that is affected. Okay, so now we can simply conclude that a medical coder who does not understand the directional term will assign wrong code, which can lead to the claim denial, legal issues and patient safety problem. Okay, so this is a statement that everyone should know, because if you are learning it for medical coding purposes or maybe for any medical thing, because this is not specific to medical coding, like even if you are working in different domain of medical, then also like it would be useful for you. Okay, fine. So now to conclude the entire session, what I'll do, I'll just tell you the important points that you should know, and it will also help you for your interviews. Okay, so first point says these terms create a universal language that is understood by all the medical professionals worldwide, which is quite true, right? This creates the universal language. Second thing is they are always based on the anatomical position. That is also true, because every directional term is based on the anatomical position. Third point says they are always relative, comparing one structure to another. Next point says they always come in opposite pair. Okay, so most frequently, most oftenly, like they are shown as opposite pairs. They are used in every field of medicine, including coding, surgery, radiology and nursing. So it doesn't matter in which medical domain you are working, it is mostly used in all of the fields. Okay. Then using the wrong directional term in medical can lead to a serious medical errors. Yes, that is also true. Like if someone use or refer different term, then in that case it will affect the entire medical output, and it will cause a serious medical issues or errors. The last point says many directional terms come from a Latin and Greek word or Greek origin, which is why they are universally accepted across all kind of languages. Okay, so I think now it's quite clear, and these points you should know because it will help you to answer the questions in interview. Now there is one memory tip for all of you, and I think with this relational thing you can easily learn the concepts. So I have mentioned think of anatomical terms of direction as a GPS system of the human body. So just like a GPS gives you the exact direction to reach the location, similarly these terms give the exact direction to find out the structure inside the human body. Okay, so I hope this entire session is clear to all of you. Now I have one question for all of you. This question is related to the anatomical directional terms itself. So what do you think, what is the key concept of anatomical directional terms? I'm 100% sure you all know this answer because this thing we have already covered in our previous session. So that's why I strongly recommend you to please do share your knowledge in the comment section so that others can take a reference from it. But in case if you don't know the answer of this question, then please refer the previous session because there we have already discussed this in detail, and from there, like once you know the answer, then you can share it inside in this comment section so that others can directly take from it. Okay, so yeah, that's all for today. I hope this session is clear to all of you. In the next session we will discuss few more things. So thank you for watching TechShare.